It's a huge honor for me to stand in front of you and talk about pediatric pancreatitis, especially our clinical trials. As I mentioned yesterday, we have a pediatric section in the Hungarian Pancreatic Study Group, which I'm part of as well. And it was established in 2012, and we started our registries in 2013, and we started the apple and pineapple clinical trials in 2014, and in this presentation I would like to talk about these trials. Yesterday I was talking about the Hungarian guidelines and what advent to test when we would like to do the genetic testing for children. We have two major clinical trials. The pineapple is about the early phase of pediatric pancreatitis, and it concentrates especially on the abdominal pain. And the other one is the apple trial, which collects the patient who had or has pediatric pancreatitis. Our studies have been discussed on our international meeting. They get the national ethical approvals, and they have been registered internationally as well. They are open for every pediatric centers all over the world, and there is an electronic form which has been developed to make it easier to perform from other countries. The International Association of Pancreatology has accepted our trials, and now they are published in Digestion. And now let's see the pineapple trial. The etiology of the abdominal pain has a really wide range. For example, if a pediatric patient comes to our ER unit, we have to think about a lot of possibilities. Normally, we start the most common and most severe ones, such as appendicitis, invagination, gastrointestinal diseases, or urinary problems. But what about the rare diseases, or the diseases what we think is rare, such as pancreatitis? We can say that the abdominal pain in children, if we have children with abdominal pain, we should think about pancreatitis, because usually the characteristics of the pain is different from adult patients. And if the patient has abdominal pain, then how do we know that it's pancreatitis? We use the 2 out of 3 rule according to international and the Hungarian guideline. And it means that it has to be 2 present from abdominal pain, elevated pancreatic enzyme levels, or positive imaging on the pancreas with an imaging method. We can see a rising incidence of the disease in the last 15 years, and if we look at the map of Europe, we can see this increasing from Eastern to Western Europe. But we can say that the pancreatitis is not that rare disease in childhood, but a rarely diagnosed disease in Central and Eastern Europe. Its cause is multifactorial. Maybe it's because of financial difficulties, or maybe because we don't think about pediatric pancreatitis if we see the same symptoms, or because we don't have evidence-based guideline for this disease. But we can say that the number of serum amylase or lipase measurement correlates with the incidence of the disease. With our Pineapple R study, our aim was to retrospectively overview 1-month patient flow in a medical and surgical emergency unit, and our hypothesis was that the number of the serum amylase or lipase measurement will correlate with the incidence of the disease, and we will see an increasing from Eastern to Western Europe. And according to patients' data, the Pineapple R Excel table should be filled out and sent to us, and it collects the patient's personal data, the main diagnosis, and abdominal pain. And if the patient had abdominal pain, the nausea, vomiting, the enzyme measurement, and imaging should be filled out too. On this map of Hungary, you can see the collaborators and hospitals that already joined us, and we are happy to say that we have a center in the USA as well. And now let's see our early results. We already enrolled 23,644 patients, and 1970 of them had abdominal pain. In this group who had the abdominal pain, 592 abdominal ultrasound was performed, and only 192 pancreatic enzyme measurement was performed. If we see these numbers in adults, we would expect at least 10 acute pancreatitis, but we only diagnosed 5 of them in the pediatric population. So pediatric pancreatitis is such an underdiagnosed disease. If we compare our earlier results with the results in the USA, we can see that we enrolled almost same amount of patients, We performed almost same amount of abdominal ultrasound, but we can see a big difference between the pancreatic enzyme measurement. In the USA, 21.6% of the cases was performed, but in Hungary, only 2.8% of the cases. So we are not surprised that in the USA they diagnosed 4 pancreatitis, meanwhile in Hungary we only diagnosed 1. So can we do anything for the better diagnosis of pediatric pancreatitis? Yes, of course we can. We would like to solve this problem with our Pineapple P study, which aim was to provide a fast, simple, and authentic scoring system to evaluate the necessity of pancreatic enzyme measurement and abdominal imaging in case of a patient has abdominal pain. Both surgical and internal medicine ER units should be involved if they are separated, and after signing the informed consent form, there is a short questionnaire which collects the patient personal details, the medical history, especially we concentrate on the last 2 weeks, the new symptoms, diet changes, new medications, or emotional or environmental changes in the life of the child. We would like to know the main complaints, especially the abdominal pain, other gastrointestinal symptoms, the admission details and physical status. And we would like to know the result of the amylase or lipase measurement and the result of the imaging technique. And now let's see our results. We already enjoy, I think these are just old results, but I'm happy to say that we enrolled 207 patients and we already discovered 5 pancreatitis. The start of the abdominal pain was varied between 18 hours to 1 month before hospitalization. The pain was cramping, strong, and mostly localized to the epigastrium. Vomiting and nausea were noted in 1 case, and both lipase and amylase level were elevated more than 3 times above the normal level. And transabdominal ultrasound showed alteration in the tissue of the pancreas in 1 case. So if pancreatic enzyme measurement is performed in all of the patients who had abdominal pain, the diagnosed pediatric pancreatitis is 2.4%, which is higher than it was in the USA or it was in Hungary that I already showed you. And we are open for every centers who provide accurate data. And now let's see the Apple trials, which can enroll patients who had or has pediatric pancreatitis. In adult patients, there are multiple studies concerning pancreatitis in adulthood, and therefore there are some evidence-based guidelines as well. But in children, we experience the lack of their numbers. And I already mentioned you yesterday that we published our Hungarian guideline in 2014, but we've experienced some low evidences during this consensus meeting. And we know that therefore more research is needed on this field. That's why we established our Apple trials. Now let's see the retrospective Apple trial, which enrolled patients who had any kind of pancreatitis under 18 years in their history. This study's aim was to understand our earlier practice in pediatric pancreatitis. It would like to specify the genetic background and to understand the importance of family history in pediatric pancreatitis. For this, after signing the informed consent form, there is a short questionnaire which collects the patient's personal data, the detailed medical history, and the etiology of the disease. And there is the possibility to perform the genetic testing. As Peter and Ákos already mentioned, we only need 2 citrate tubes blood for this. It has to be stored in -20 degrees, and it has to be shipped to Szeged. And all costs are covered by us. And now let's see the prospective Apple trial, which collects the patient who has newly diagnosed pancreatitis under 18 years. The study's aim was to get more details and recognize better the course of the pediatric pancreatitis. It would like to specify the genetic background and identify the early risk factors of the disease. And it helps us to establish the severity of the disease at admission. At admission, after signing the informed consent form, there is a short questionnaire similar to the retrospective one. It contains the patient's personal data, the detailed medical history, the etiology of the disease, the main complaints and symptoms, and the physical status and vital parameters. There are some obligatory laboratory parameters that should be filled out. We would like to know the result of the imaging technique and the immediate therapy. And now there is again the genetic testing. The manner is the same as in the retrospective study. And there is another form in the prospective study, the so-called B form, which has to be filled out on every day on the ward. And there are no obligatory factors on this sheet. We would like to know just the current clinical practice. And now let's see the results. We already enrolled in the Apple-R study 57 patients, and 61% of them had acute, 14 had recurrent acute, and 25% of them had chronic pancreatitis. If we see the etiology of the disease, it was 9% drug-induced or connected with biliary problems. And according to international data, we got 54% idiopathic pancreatitis. And usually in children, if the etiology of the disease is idiopathic, it usually connects with genetic factors in the background. So we performed the genetic test, not just the idiopathic, but in the non-idiopathic cases as well. We already performed 35 genetic tests, and we found four cases with PRSS1 mutation, 6 with SPINK1, 1 CFTR, and 18 CTRC mutation, and we found 5 combined mutation. And our data showed that we have found positive genetic variant in 95% of the idiopathic and in 47% of non-idiopathic cases. And in summary, we can say that genetic testing should be performed for every patient with pediatric pancreatitis. After signing the letter of intent to join to the Apple studies, you have to fill out the form that I already mentioned. These forms are available, and the study protocols are available for free on our website, and as Peter mentioned, it's available on Russian as well. But if you need the Ukrainian version, we are really helpful with that. And we are open for every centers who provide accurate data, and we are really generous because after 5 patients, we can give you 1 authorship. And please join the Pineapple and Apple studies. We are looking forward to welcome new centers. And thank you. I would like to say thank you for my colleagues, hospitals, and institutions and grants who helped me to be here. And thank you for your kind attention.